Hello and welcome back to my YouTube channel Easy Nursing. In this video, I'll be discussing the puerperal sepsis, which is a common complication of puerperal period. First of all, what is puerperium? It is the postpartum period of 6 weeks post childbirth or the post delivery period, during which the pelvic organ return to the near pre-pregnant state and the physiological changes of pregnancy are reversed back. Now, the puerperal sepsis is defined as infection of genital tract at any time after delivery of fetus till the 42 days of puerperium. So there are many complications of puerperal period, but the most common is the puerperal sepsis. Next is the predisposing factor. There are certain factors which influence the pathogenicity of vaginal flora. It can be the introduction of organism from outside during delivery, or the lower general or local host resistance, mainly the multiplication of organism in the devitalized tissues, and also the relative increase in drug resistant organism. The predisposing factors can be divided into antepartum, intrapartum and the postpartum factors. The antepartum factors include poor general condition, malnutrition of women, anemia, lower socioeconomic status, extreme of age, and also the poor ANC care and the pre-existing QTI. The intrapartum factors include premature rupture of membrane, preterm labor, frequent PV examination, obstetric, that instrumental delivery where the healthcare workers follow the delivery without following proper aseptic technique, and many more. The postpartum factor include the postpartum hemorrhage. The etiology: it can be caused because of aerobic bacteria and anaerobic bacteria and other bacteria. In aerobic bacteria, it includes the gram-positive and the gram-negative bacteria. Gram-positive bacteria is the beta hemolytic streptococci, and gram-negative bacteria include the E. coli. Spread of infection: the route of spread of infection is first of all the primary site, that is uterus, and next is the secondary site, the surrounding area of the uterus, that is the pelvic cavity. So here the symptoms are according to the site of infection. So if it will be occurring in the endometritis area or endomyometritis area, there will be only a fever, rigor, then the abdominal pain and the tender uterus and sub-involuted uterus and the foul smelling lochia. But when it will occur in the pelvic peritonitis and pelvic abscess area, it will include the high-grade fever with tachycardia, tachypnea and pain, tenderness in the fornices, and also the bulging mass in the posterior fornix due to the collection of pus in the abdominal cavity. Next is the diagnosis. How we will come to know that a woman is having puerperal sepsis. The puerperal sepsis should always be suspected in a case of puerperal pyrexia unless proven otherwise, and also the history taking any predisposing and high risk factor during ANC, intrapartum and postpartum period. The physical examination include the systemic examination of all the body parts, then the pelvic examination, which include the color of lochia, abnormal odor, examination of perineum and other any infection, and investigation include the blood culture, chest x-ray, ultrasound, urine analysis and culture. Next is the treatment and prevention part. The treatment and prevention part include the pneumonia, that is buffalo, blood culture to be sent, urine output measurement, IV fluid, IV antibiotic, lactate measurement, oxygen supplementation. This is a short discussion of prevention and treatment part, but I'll be discussing the prevention and treatment part in my next video. So please follow my channel, subscribe my YouTube channel, so that you will come to know about how we will prevent and treat the puerperal sepsis. So yeah, this was the only I have discussed in this video about puerperal sepsis. The short overview about the puerperal sepsis is that it is the puerperium is the 6 week period. The puerperal sepsis definition, then the risk factor, then the causes, signs and symptoms, then I have discussed about spread of infection and then diagnosis, and in the next video I'll be discussing the prevention and treatment part. So thank you so much.